Good morning, this is YouTube Medical University. This video is something that is rarely taught in hospitals. This is about how to reduce high blood pressure, how high blood pressure can be lowered without medication, how high is too high for blood pressure, and when it should be lowered, what are the actual disadvantages of having high blood pressure. And if you watch this video, you will understand all of these things in a simple way. In reality, there are many special features on television and magazines about prevention, but there is too much information and it's hard to know what to refer to. You may have been told that your blood pressure is high, but you don't want to rely on medication yet. After all, do we really need to lower things like blood pressure and blood sugar? Isn't it just that hospitals want to sell medicine? Doctors on television say that high blood pressure and high blood sugar are dangerous. There are various magazines that say if you drink this supplement, your blood pressure will go down. But is there really such a thing? If you're even a little concerned, please watch until the end. After watching this video, you might think, high blood pressure is a big deal for me, so I'll try to work on it. This method might be worth trying without pushing myself too hard. I hope you'll think that way, so please listen until the end. I am a general practitioner in Hokkaido, usually prescribing medication for high blood pressure and advising on lifestyle and diet. I started YouTube to disseminate correct knowledge based on such experiences. The video may be a bit long, but I would be happy if you could listen to the end and learn from it. So, here is today's agenda. First, for the sake of health, I will explain how Japanese people harm their health using Japanese statistics. Second, I will explain the 3 diseases that become a risk of arteriosclerosis, which I call the 3 brothers of arteriosclerosis. Third, I will explain the definition of high blood pressure and what good things can happen to the body by lowering blood pressure. Fourth, I will introduce 4 things to be aware of if you have symptoms that are characteristic of people with high blood pressure, diabetes, or high cholesterol. Fifth, I think everyone is interested in this, but I will talk about how to lower blood pressure without relying on medication while showing data. Now, let's get started. Please watch this video. The number 1 reason for needing care is cognitive impairment, but this is the second place. Do you understand what this is? The answer is cerebrovascular disease, which includes things like cerebral infarction. If you have a cerebral infarction, you may experience paralysis of the body, loss of sensation, or inability to speak, and you may need support from those around you if you don't have it. This can lead to a state where you can't live alone. And at the very bottom, this yellow heart disease is also a condition where the blood vessels of the heart are damaged or narrowed, so that the heart does not get enough nutrition, leading to myocardial infarction or angina pectoris, where the heart's function deteriorates. You get out of breath just by moving a little, your whole body swells and you become unable to move. The other reasons why care is needed, such as old age, cognitive impairment, fractures due to falls, are certainly serious, but as anyone ages, it's inevitable that muscle strength will gradually decline and the likelihood of developing cognitive impairment will also increase. Therefore, it's important for everyone to prevent what can be prevented among these. That's why I want to emphasize this time on cerebrovascular disease and heart disease. If you add up these two, it becomes more than cognitive impairment. In other words, in order to live a healthy life at any time, it's important to prevent these cerebrovascular diseases and heart diseases. By the way, for those who thought there is no way to prevent cognitive impairment, there is a link to a past video where I talked about it in the overview section, so please check it out from there. So, what should we do to prevent these 2 diseases? The cause of both cerebral infarction and myocardial infarction can be said to be one, and it's not an exaggeration. What do you think it is, everyone? Yes, it's a disease related to blood vessels, or in other words, arteriosclerosis, where the blood vessels harden. When the arteries are damaged or plaque, which is like oil, sticks to them, the blood vessels become narrow, or a blood clot, which is a clot of blood, gets stuck, causing the heart or brain to not get enough blood flow, leading to myocardial infarction or cerebral infarction. And this arteriosclerosis is written as arteries harden. If you thought it's okay because the arteries harden and become firm, you're mistaken. Do you think it's better for your blood vessels to be made of glass or rubber? Blood vessels made of glass may indeed seem hard, but if they take a little shock, they seem likely to break, whereas blood vessels made of rubber can stretch a little, and even if they take a shock, they seem unlikely to break due to their flexibility. That's right. Arteriosclerosis, or hardened blood vessels, are prone to breaking. There's a risk. It's often featured in television dramas, but subarachnoid hemorrhage, which is a disease caused by the rupture of brain blood vessels, is also said to be caused by arteriosclerosis. In other words, if we can prevent this arteriosclerosis, we can prevent these heart attacks and strokes. Let's start with the story of arteriosclerosis, which is a crucial topic covered in the high blood pressure video. Next, I'd like to introduce arteriosclerosis' 3 brothers. Arteriosclerosis is crucial in preventing heart attacks and strokes, the three main causes of arteriosclerosis, which I personally call the three brothers of vascular blobs, are important to understand. To conclude, high blood pressure, diabetes, and dyslipidemia are said to be the causes of this arteriosclerosis. Other factors include being overweight, being male, and smoking. There are other risks, but these three are the most important diseases. For example, high blood pressure. When blood pressure is high, the pressure inside the blood vessels increases. This pressure can damage the blood vessels, making them fragile and hard, which can cause arteriosclerosis. Dyslipidemia is a condition where cholesterol is high, but this cholesterol is something that carries oil. Therefore, if this is high, it can carry oil into the blood vessels, and it is said that oil plugs in the blood vessels, but such things stick to the blood vessels, causing the blood vessels to narrow and become clogged. And actually, diabetes is also a cause of arteriosclerosis, please be aware of this. Diabetes is a condition where the blood sugar level, the sugar content in the blood, is high. Please think of it as a lot of sugar flowing in the blood vessels. Then, wouldn't the sugar hit the walls of the blood vessels and damage the blood vessels, making them likely to become blobs? It's okay to have such an image. Strictly speaking, when the sugar content in the blood rises, it is said that when it moves into the cells, something called active oxygen is produced, inflammation occurs, and the walls of the blood vessels become ragged. How about that? I think it's slowly connecting. The reason why it's said on television and in hospitals that we should lower our blood pressure or blood sugar levels is because we all want to prevent arteriosclerosis in order to stay healthy in the future. This is to prevent things like cerebral infarction and myocardial infarction. That's why we're told to lower our high blood pressure, diabetes and cholesterol. This is actually what medical professionals want to convey, but often they can't explain this in a television program or in a consultation room where time is limited. And after all, money is made in the process of treating diseases, so the conversation tends to focus on treatment. However, the most important thing is to prevent diseases before they occur. So please watch this YouTube video and try to reduce the risk of disease at the pre-disease stage or before the disease occurs. That's what I think is important. So if you agree with this idea, please hit the like button and subscribe to the channel. I'd be happy if you could wait for new videos. Thank you for waiting. In the next chapter, we'll discuss how high blood pressure is considered high and whether it's better to measure blood pressure at the hospital or at home. And what are the benefits of lowering blood pressure? I'd like to explain about these things. So, have you ever measured your own blood pressure? Do you know from where it is considered high blood pressure? This time I will introduce just one easy to understand value. If your blood pressure measured at home exceeds 135/85, please suspect high blood pressure. Strictly speaking, the values can differ when measured in a consultation room and at home. But what I want to emphasize this time is the importance of measuring your blood pressure at home. Why? Because it's much more important than measuring it in a consultation room. I also see outpatients at the hospital and directly measure their blood pressure. But sometimes when I measure it in the consultation room, they say, "I don't usually have such high blood pressure, am I okay?" In fact, it's often okay. The environment is always different when you measure your blood pressure at the hospital, and your heart may be pounding more than usual, which often results in higher blood pressure. This is called white coat hypertension. It's named this way because your blood pressure tends to rise when you see someone in a white coat. Now, please take a look at this chart. The white coat hypertension on the lower right is what I mentioned earlier, where the blood pressure is high in the consultation room but not at home. On the opposite extreme, in the upper left, is what we call masked hypertension. This is when you measure your blood pressure at the hospital, but at home you rarely measure it. However, when you were told by your doctor to measure your blood pressure at home, you found that it was surprisingly high. In other words, it's a pattern where it seems like you don't have high blood pressure in the consultation room, but in fact you do have high blood pressure at home. People with masked hypertension have the same risk of vascular diseases as those with high blood pressure, even if their blood pressure is low at the hospital but high at home. Don't assume you're fine just because your blood pressure is normal at the hospital. Measure your blood pressure at home, even if just once a week. Do it in the morning and before bed, record it for a week and calculate the average. If it's over 135/85, try non-medication methods to lower it or consult a doctor. Don't assume you're fine because your hospital readings are low. Actually, it is said that 1 in 3 adults has high blood pressure. Therefore, 1 in 3 people watching this video may have high blood pressure. And about the effect of lowering this blood pressure, there is data that if the average blood pressure of Japanese people drops by 4, we can save 10,000 patients from having a stroke. Just by lowering your blood pressure by 4, you can prevent 10,000 people from having a stroke. Isn't that amazing? Even if you have high blood pressure, if your blood pressure drops by 10 from 150 to 140, the risk of brain diseases such as cerebral infarction decreases by 27%, and the risk of heart diseases such as myocardial infarction decreases by 17%. It is said that even the final mortality rate decreases by 13%. Let's also look at the risks caused by high blood pressure and high blood sugar levels. Please take a look at this chart. It shows the proportion of causes that the person had when Japanese people died. In this example, smoking is considered the cause of cancer deaths, represented by the top bar. The pink bar shows the proportion of heart diseases like myocardial infarction. Tobacco is clearly a risk factor, but glucose tolerance abnormality, simply put, diabetes, is also a significant contributor. Hyperlipidemia, to put it simply, means having high cholesterol. These causes influence and increase the risk of heart disease. I apologize for being blunt, but things like high blood pressure and high blood sugar. I think it's clear that having high cholesterol affects heart disease, and I've also compiled data on high blood pressure in Japan. It's a graph showing the risk of heart disease due to high blood pressure. As you move to the right, blood pressure gradually increases, but when the systolic blood pressure exceeds 140, the risk triples, and those whose systolic blood pressure exceeds 180 are said to have 5 times the risk. This graph shows the risk of heart disease in people with high blood sugar or diabetes. This hemoglobin A1C is a measure called hemoglobin A1C that indicates high blood sugar levels. Please understand this as a rough guide. If this value exceeds 6.5 on the far right of the graph, it is considered diabetes. But as you can see from the graph, the risk of heart disease increases at levels above 6.0. In other words, even people who are not diagnosed with diabetes, if their blood sugar levels are high, the risk of heart disease is high. Does that make sense? You now grasp the significance of blood pressure and blood sugar levels. In fact, I also treat patients who have had myocardial infarctions, and when I examine them, most of them are smokers. Most of them have risks such as high blood pressure, diabetes, or high cholesterol. I realize this from my daily medical practice. It happens quite often. It's scary because there are no symptoms for conditions like hypertension, diabetes, or dyslipidemia. So, are these conditions dangerous if they don't have symptoms? I would like to introduce 4 symptoms that suggest you should consider a hospital visit, even if you don't fit the profile for hypertension, diabetes, or dyslipidemia. In fact, most people with hypertension, diabetes, or high cholesterol don't have symptoms in the early stages. So, even if you don't fit the profile for these conditions, please consider getting your blood pressure checked or having a health screening. Conversely, if you do fit the profile for these conditions, there's a high chance you're at risk, so please consider a hospital visit. Now let's look at the 4 dangerous symptoms. The first one is a headache. You might be wondering, why a headache? This can happen with a condition called hypertensive encephalopathy. High blood pressure can cause headaches, make your head feel heavy, or induce nausea. I often have headaches and wonder if they are regular headaches. Some people diagnosed with headaches were actually suffering from hypertensive encephalopathy, so please be careful. If you have a headache, check your blood pressure. Note that high blood pressure can also be caused by other factors. The sympathetic nervous system is activated, constricting blood vessels. This reduces blood flow to muscles, hindering muscle fatigue recovery, possibly causing stiff shoulders. If you have headaches or stiff shoulders, remember to check your blood pressure. The image shows the second of 4 dangerous symptoms of arteriosclerosis. You might notice a yellowish substance on your eyelids. This is called xanthelasma. This is a condition where the cholesterol-carrying oil accumulates on the eyelids, and it is also one of the symptoms that may indicate high cholesterol levels. It's okay if it turns yellow here, but please take a look at the top of your eyelids in the mirror. However, there is one point to note. Just because you have xanthelasma doesn't necessarily mean you have high cholesterol. 2/3 of people with xanthelasma have normal cholesterol levels, but on the other hand, 1/3 of people have high cholesterol levels. So it's not always the case that you have high cholesterol if you have xanthelasma, but if you do have it, it wouldn't hurt to check your cholesterol levels. By the way, if you are bothered by the appearance of xanthelasma, you can have it removed with surgery or reduced with a laser, so please consider getting it checked. The third of the 4 dangerous symptoms of arteriosclerosis is dry mouth. Those who are health conscious may already know what symptoms these are. Here it is. These symptoms are caused by high blood sugar levels. When your blood sugar level exceeds about 250, those with high blood sugar levels start to get thirsty and drink water incessantly. Do you understand why? Please remember this. When our blood sugar level rises and our blood becomes thick, our body responds in this way. To prevent heart attacks and strokes, our body sends signals like, "It's dangerous, your blood vessels may get clogged." That's why we start drinking more water. It's a defensive response. Those who get thirsty and drink a lot of water are at risk for heart attacks and strokes. Consider it a danger signal. When blood sugar levels rise, osmotic pressure increases, causing us to drink water to dilute it. This is a simplified explanation. Thirst doesn't always indicate diabetes. It can also result from dehydration or excess salt intake. Be aware of this. Now, let's discuss the dangerous symptoms of arteriosclerosis. The fourth choice. The fourth one is this. It's snoring and sleep apnea. I think many of you have heard of a condition called sleep apnea syndrome. What is the relationship between this and arteriosclerosis? Actually, this sleep apnea syndrome is considered to be a risk for high blood pressure, diabetes, and lipid abnormalities, and the correlation with high blood pressure is particularly high, and it is known that if you treat those with this sleep apnea syndrome, the blood pressure will somehow decrease. Therefore, those who have this sleep apnea syndrome, by treating this, the blood pressure may decrease, or future diabetes, etc. It is also said that the risk of lipid abnormalities decreases, so if you match these symptoms from now on, please consider getting a checkup. Someone around you. If you've been told that you stop breathing in the middle of the night, etc. Or you wake up in the middle of the night because you're struggling to breathe, or you frequently wake up because you need to go to the bathroom at night. As for daytime symptoms, you suddenly get drowsy, can't resist sleepiness, and suddenly fall asleep. If you are too sleepy during the day, can't concentrate on classes or work, have headaches along with daytime sleepiness, there is a possibility of sleep apnea syndrome. As for treatment methods, there are methods such as wearing a mouthpiece or continuous positive airway pressure, which sends air to the nose while sleeping to prevent this from collapsing. So please, if your symptoms match, we recommend visiting an otolaryngology clinic for an examination. Thank you for waiting. In the next chapter, I would like to introduce foods that lower blood pressure without relying on medication. In other YouTube videos, I also talk about breathing techniques and such. There are introductions to various things like stretching on other YouTube videos. However, this time I want to introduce things that have actual data. Honestly, there are videos recommending things without data, but I don't necessarily think that's always wrong. Whether there's an effect or not, if it's something unknown, it's up to you to try it out. And the things I introduce in this video have certain data, so I think it's better to try these first before things without data. I want to introduce things that are relatively easy to incorporate. So the food that I recommend for lowering blood pressure is something called the Dietary Approaches to Stop Hypertension diet. For those of you who have never heard of the Dietary Approaches to Stop Hypertension diet, don't worry. What's important is not the name, but the content. The Dietary Approaches to Stop Hypertension diet is a diet developed in America to lower blood pressure. But what are its characteristics? It reduces salt and carbohydrates, but what does it replace them with? Minerals like potassium, magnesium, and calcium. It's about dietary fiber, taking plenty of these. The dietary method is called the Dietary Approaches to Stop Hypertension diet. You don't actually need to perfectly follow this diet. What I want to convey here is that there is a possibility that your blood pressure can be lowered by incorporating the things included in this Dietary Approaches to Stop Hypertension diet into your life. Specifically, what to take. Fruits, vegetables, tofu. Incorporate dairy products. In fact, when it comes to data, when patients with high blood pressure tried this diet, compared to those who didn't try it, the upper blood pressure dropped by 11.4 and the lower blood pressure dropped by 5.5. And what's even more amazing is that after trying this Dietary Approaches to Stop Hypertension diet, it is said that the effect of lowering this blood pressure continued for 8 weeks. So it's not just while you're on the diet, but it's also understood that the effect can be obtained in the long term. So please, if you're concerned about your blood pressure, try changing your snacks when you're a little hungry, from high salt snacks to fruits. For example, bananas contain dietary fiber and are rich in potassium, and they are also cheap, so just changing the potato chips you usually eat to bananas may lower your blood pressure. And one of the tricks to lower blood pressure that I want to recommend is this, a thing called yasashio. I'm also trying this, but this yasashio is a kind of salt that uses potassium. This yasashio also contains sodium, but the remaining half is composed of potassium salt. This potassium is actually attracting attention. I mentioned earlier that potassium is important even in a DASH diet, but normal salt contains sodium, which is said to be a cause of high blood pressure. This potassium is said to have the effect of excreting sodium when it accumulates in the body. That's why it can lower blood pressure. There is such data about potassium. It is said that if people with high blood pressure take 5 grams of potassium a day, their blood pressure will decrease from 7.2 to 4.1. Isn't that amazing? If your blood pressure drops by 10, the risk of various diseases drops from 20% to 10%, as I introduced earlier. By the way, the average intake of potassium for Japanese people is about 2 to 0.08 ounces per day, so we are not taking enough potassium to lower blood pressure. Therefore, if you use this yasashio, you can suppress the intake of sodium that you usually take in with salt and at the same time take in potassium, so you can suppress the cause of raising blood pressure and take in the component that lowers blood pressure. It's a 2 birds with 1 stone salt. I think that there is no such thing as not using salt in regular cooking, so I think that there may be an effect just by changing the usual salt to this yasashio. By the way, I don't receive any money from this yasashio. By the way, for those with reduced kidney function, there may be a case where potassium cannot be excreted and potassium rises too much. So especially those with bad kidneys should use this yasashio. Please consult with your primary care doctor. Here are some other foods and lifestyle habits that have data that blood pressure will drop a little. It's fish oil. It's PA-eicosapentaenoic acid and docosahexaenoic acid, like mackerel and salmon. These are components often found in bluefish, and there is data that taking these can lower blood pressure by 4.5 in people with high blood pressure. It's not always possible, but regular exercise also has a significant effect. Regarding exercise habits, it's said that blood pressure dropped by 5 to 10 compared to when aerobic exercise was not performed 3 times a week. As for dietary fiber, there is data that blood pressure dropped by 1.2 when 0.388 ounces were taken per day. And this is a surprising value. But there is data that blood pressure dropped by 2 places when 5 milligrams of vitamin C were taken per day. If I were to summarize these, it would be best to suppress salt intake and consume more fruits and vegetables, especially vegetables, as I mentioned at the beginning. Things like magnesium and calcium contained in dashi food. Things like bok choy, broccoli, avocado, etc. Be conscious of taking in such vegetables or replacing meat with fish oil, for example. I think that just doing that will significantly lower your blood pressure, so please try it out from what you can do for yourself. And when I talk about such videos at the end, I want to try anything and everything, but overdoing it is not good. It's counterproductive to overdo it and become unable to continue so if possible. Begin with small steps. Even if you're eager to attempt a lot, try one thing at a time. Don't push yourself to the point of pain. From tomorrow, just this, if possible, maybe just 5 minutes a day. If possible, maybe some exercise. Maybe you can do things like not using the elevator when you usually do your job, and using the stairs instead. Maybe you can do things like bringing a can of mackerel for lunch, or maybe you can't. Maybe you can just replace your dessert with fruit, or maybe you can't. Even one try is fine. How was it? This time, it's something that can't be taught in a hospital and isn't dependent on medicine. We talked about a method called high blood pressure resolution and how high blood pressure, diabetes and high lipids can be a risk. It's always better to prevent what can be prevented for your health, and to prevent heart attacks and strokes, let's prevent arteriosclerosis. And to prevent arteriosclerosis, it's important to manage high blood pressure, diabetes and lipid disorders. We talked about this. And these are called lifestyle diseases. And when these lifestyle diseases progress, early symptoms such as headaches, yellow eyes and dry throat appear. We introduced about sleep apnea. And finally, we talked about foods that lower blood pressure, including dashi and potassium, and delicious vegetables, and other things like fish oil, exercise, vegetables, and uric acid. It's too unreasonable, but even one is fine. I would be happy if you could incorporate it into your life. We will continue to post videos that will be useful for your health from tomorrow. So if you could register for the channel so that you don't miss the next video, it would really be encouraging. It was a long video, but thank you for watching until the end. Let's meet again next video.